Hey mamas, you're listening to the Balanced Working Mama podcast, the only podcast teaching you how to balance your work, motherhood, and wellness. I am Dr. Amber Thornton, clinical psychologist and mama wellness consultant. Each week we dive into tips and strategies and much more so that you too can become a balanced working mama. Let's dive in. Hey mamas, we have a really special guest today and also a really special topic that I feel like a lot of us have been experiencing, have faced at some point in our lives. And I am so excited to have one of my friends here to talk with about this thing, this experience. So Raye, can you please introduce yourself? Let us know who you are and what we're going to talk about today.
Absolutely. Thank you so much for having me. My name is Raye. I am a mom. I am a nurse. I am a doula, a full spectrum doula. So I don't just do birth and postpartum, but I service all people throughout their journey, whether that's fertility, loss, birth, postpartum, whatever is going on. I'm also a certified breastfeeding specialist and postpartum mood disorder certified. And everything about reproductive justice and maternal health and babies and children is my heart and my passion, and I absolutely love what I do. And that is why I'm so grateful to be talking with you about PCOS, something that I battled before having my own son and still on my journey of learning what life battling PCOS looks like postpartum and beyond.
Yes. Oh my gosh. Thank you, Raye, so much. I'm so excited to have this conversation with you about PCOS and more specifically about how we navigate it while also loving our bodies. I think that's the special component that we're going to add to it. So today we're definitely going to talk about like what PCOS is, like what it means to maintain it, but then also what it means to love our bodies in the process. Because as you know, and I know too, because I shared my experience of PCOS on my Instagram a few months ago now. I might actually dig that out of the archives and share
Yeah.
it. But it's definitely for me, the experience was it made me feel really bad about my body and myself.
Yes.
And just, I know that's a part of it. But first, I want to just start by, you sharing a little bit about your story with
Okay.
PCOS. Well,
Okay.
first, let's actually tell people what PCOS is. When we say PCOS, we're talking about Polycystic Ovarian Syndrome.
Right.
So we'll say more of what it is, but you go ahead, Raye. Tell us your experience.
Okay, so just to start off, we say PCOS, that is polycystic ovarian syndrome, like you mentioned, and PCOS can look different for everybody. So there's not just like one or two symptoms that everybody has, and that's automatically PCOS. It truly is a multi-system disorder. So it can show up in your reproductive system, and that might look like irregular cycles, or that could look like extremely heavy and painful cycles for some people. Some people even struggle with just like random spotting throughout the month, that kind of thing. And then you have other people who suffer from insulin resistance and they may have trouble losing weight, or they put on weight really quickly. And then for other people, that unstable blood sugars and the effects of PCOS show up in your skin or in your hair. So you may have acne really bad, or you have thinning hair, or it may show up like people don't realize that unstable blood sugars can affect your mental health as well. So it might look like anxiety or depression. And so PCOS can have so many symptoms. And a lot of times people don't think that it is the PCOS. So it's almost like this invisible syndrome that is going on behind the scenes. And that is really when I find that it can really mess with your body image and your self-esteem, because you're like, why is my body failing me this way? Or why am I feeling this way? I've gone to the doctor. They don't see anything that is causing these things. They're just telling me to lose weight, and it leaves you being frustrated and all of those things that come along with PCOS. And that was definitely my experience. I started looking up PCOS actually on my own when I was in nursing school, because I was like, something about this is not right. I knew I had been on birth control before because my cycles were really heavy. And I didn't want to go back on birth control because I didn't have a good experience with it the first time. And I was like, but there has to be a reason why my cycles are this way, right? And I went to the OBGYN and the answer was just lose weight. And so I went to another OBGYN and it was like, lose weight, get on birth control. I went to another OBGYN and she's like, there's nothing wrong with you besides the fact that you need to lose weight. And I'm like, this is not true. Why is nobody listening to me? I'm asking for tests, like I'm in nursing school and then I was a nurse, so I know how to advocate, but nobody is running the test. And it was just a really frustrating experience, especially when you add on trying to have a baby in the mix. So then you're feeling like my body is not cooperating. I'm trying to have a baby. It's not happening. And all the doctors tell me is you're just an overweight Black woman. You just need to lose weight. So it took years and switching providers for me to finally get a provider that would run the actual labs that I needed, do an ultrasound to look at my ovaries and that sort of thing. And finally, when I got there, it was like, yes, a provider that listens. Finally, I'm so happy. But then it's like, wait, I got the diagnosis of PCOS and infertility and endometriosis all in one day. And it was like, what is even happening? And it was just like a crush to my heart and to how I felt about myself as a woman.
I can only imagine. Like, wow. And I think the frustrating part is, the feeling of not being heard and listened to by your
Yes.
providers when you knew there was something going on.
Right.
Like that's really, really frustrating. And like you said, you're in the medical profession. And so it's baffling that they would not listen to you and take your
Right.
concerns seriously.
Absolutely. And I think it just shows that, like, if I'm a nurse and I have the educational background, I know how to say, like, this is going on, I know what's going on with my body. And then they still don't listen to me. It just shows how much the system truly is broken when it comes to maternal health.
Very, absolutely. And I know my experience was a little bit different in that I was diagnosed with PCOS at 17. I was 17 years old. And so it was very early. And again, I'll reshare my experience. I shared it on my Instagram months ago.
Right.
But my story was that I knew like when I was 15, 16, that something wasn't right, but it was opposite. My periods went away. They just stopped. And I was young. And so I was like, ooh, don't have to worry about those. And so
Exactly.
just didn't, seem like a concern. But the other really big symptom that I had and always have had is acne. Really terrible acne as a teenager. And even now I still have some adult acne that I'm trying to manage, but it
Mhm.
all goes back to that PCOS. And so
Right.
me going to the dermatologist when I was 17, him noticing that I had like chin hairs and other hairs on my upper lip and thinking about my testosterone levels, and that appointment was the thing that then made the ball rolling with
Gotcha.
regard to me being tested with regard to my hormone levels, getting the ultrasound for my ovaries, and then boom, PCOS.
PCOS.
But I think the thing for me that was frustrating is that there was really no education for me or my mother about it. It was just like, okay, well, she'll just take these birth control pills and that's it.
Oh,
And so
no.
I think that's sometimes the story for younger women, but I see how this can be so much more complicated when you are a woman who is trying to have a child. You can't just take birth control pills because you need to be able to be fertile. And so it's
Right.
wow. So, but
Right.
I want to ask you, what are some of the just really fundamental things that we should know about PCOS?
And this ties right into this question, what you said,
Mhm.
like when you find out when you're younger and they give you birth control pills, but they don't tell you any of the lifestyle things to do to help your health long term. And that's one reason why I'm really passionate about this topic is because with PCOS, you have the chance of having that, developing that insulin resistance, which affects your endocrine system, but not only that, your cardiovascular system, because if you're going all of these years and your blood blood sugar is just fluctuating up and down, that's increasing your chances of having like cardiovascular disease, right? So stroke and heart attack. And we already see that in Black women so much. And then we have all these people with PCOS that's going undiagnosed, or we're just getting put on birth control, and that's not doing anything for the insulin resistance or your heart. And I don't want to see us struggling from diabetes and heart attack later on down the line because all we did was take birth control and think that that was it for the PCOS. Like, I got my cycles, coming on time. So that's it, because that's truly not it. Like, we need to look at living a lifestyle that is, um, that promotes health with PCOS. So making sure you're taking care of yourself, making sure you're eating well, which I already know you do so good. With eating a diet that's good for PCOS and managing your stress. That those are two main things that we need to do when we have PCOS, and also moving our bodies. And it doesn't have to be like extreme exercise, but just doing that cardio, doing that strength training to lower your cortisol levels, lower those stress hormones so that your other hormones can balance out, and so that you're promoting good heart health. And so that's what I really want people to know, is that birth control doesn't cure PCOS. Like, we have to take control of our health when we have this diagnosis.
Yep. And I think that's the thing that, medical professionals are great. We need them.
Yes, we do. We do.
And, their job is symptom management, symptom reduction. And so that birth control, it made my acne go away and it made my periods regular, but it didn't do anything for, the deeper parts that I needed in terms of knowing how to take care of my body. Like, I started taking birth control, then went to college and ate terrible. Like, probably did more damage to my body after going to college. But it wasn't until I went to grad school that I really started to take my health more seriously and started to be able to come off of birth control because of how the lifestyle that I was living. But all of that was self-taught. And it's really frustrating that so many of us go into this not knowing what to do. And I feel like that's a whole other episode, but I really want us to focus on, the part about loving ourselves with PCOS. And I want to ask you, either from your personal experience or from working with other women, how does PCOS impact a woman and how she feels about her body?
Absolutely. So I feel like all of my clients always say that we are just like sisters and we all feel the same. So I feel like I'm speaking for them too when I say PCOS can really make you feel like your body is failing you, and also that you're not worthy as a woman, if that makes sense. Like, a lot of us are little girls and like we dream of becoming a mom, and we have these fairy tale versions of what our life is supposed to look like. And then PCOS is like a wrecking ball, because you're here, you're struggling with your mental health, you're struggling with your weight. And then for people like me, you're struggling to have a baby. So it's like none of this is going like I envision, and I can't do the things that I really want to do. So it kind of just like knocks your self esteem down, all the way down into the ground. And I wish that I would have heard this conversation when I was first diagnosed with PCOS and infertility, because I didn't focus on that part. Like, my focus was on having the baby, not building myself back up, not realizing that what I was going through was just knocking down any self-love that I had.
Mhm. Absolutely. Wow. Like, that just resonates so much. And I know that was definitely, like, as soon as you said it, it makes you feel like your body is failing you. I just had this deep sigh. Because that's exactly how I felt. So my personal experience, I felt that same way, like my body has failed, or, actually, no, I think for me, the thing was my body is broken.
Yes.
I felt very like, there's something wrong with my body. It's not failing, it's just deficient.
It's not
Um,
working.
and it made me feel like I wasn't a woman, like
Yeah.
I wasn't full, like a full woman. Like I wasn't,
Right.
I don't know the right word for it, but I didn't feel as womanly as other
Right.
women.
Right. Absolutely. And I think that I don't think we should ever feel that way, right? Because our worth is not dictated by our reproductive status, right? So we are not any less of women if we have a kid or if we don't have a kid. But when you are struggling with your cycles, or if you're having extended periods of bleeding, or you're struggling with extreme pain, like it's hard to feel womanly when your womb is disconnected and imbalanced. And that's the thing.
Absolutely. Oh my gosh. Yeah. Like I know there's so many mamas who are listening to this and who just really can resonate so much with what we're saying. And again, my heart goes out to the mamas who are struggling with PCOS while trying to have a baby. Because I know for me, my experience was that my goal of it was really much younger before I was wanting to have
Gotcha.
kids, and I was able to make some lifestyle changes that helped me. So while having my children, I didn't struggle with infertility. But I think one thing that happened after I had Eden, I had a doctor's appointment and they were like, yeah, it looks like there's some PCOS. And I was like, oh my gosh, I thought that was gone.
Like I thought I didn't have to deal with that anymore. I mean,
Yeah.
same here. Same here. Like I was so focused on just having the baby, and I felt like, oh, I got pregnant, so that's it. I'm done with this PCOS thing. We're all good to go. But no, you have to keep living the lifestyle, and you
Yes.
have to keep doing all the things, because having a baby does not equal heal from PCOS.
Hell no. And I think that was my misconception. I thought like, oh, I had 2 babies. My periods are regular. I'm good. And the doctor was like, well, your ultrasound indicates. And so for me now, I feel like I'm trying to navigate it in this other part of my life. Like, what does it mean to have PCOS now that I'm not having any more children? How do I manage this? What does it mean for me? But again, my heart really does go out for mamas who are struggling with this while trying to have a baby. Regardless, it's tough, it's hard. And I think it's so important for us to be talking about the self-love piece while navigating
Absolutely.
PCOS, because I
Yes.
feel like this is the part of the conversation that is not had so often. I'm sure that, we could all Google some resources of like, okay, well, what should we do? There's a lot of books and really good resources for like lifestyle changes,
Yeah.
and, health things about PCOS. And maybe one day we'll have an episode about that. But, why do you feel like it's so important for us to really zone in on the self-love part?
Absolutely. So I feel like when you're dealing with something like PCOS already, and you have all of these thoughts internalizing about yourself and about your body, what you think about and what you say about your body over and over is only going to manifest, right, or magnify what you already have going on. So I think that it's really important to say things like, I am diagnosed with PCOS, but PCOS is not my life and it does not dictate my worth. And I am valuable in spite of having PCOS, right? And doing things that help you to feel good about yourself instead of things that just make you feel worse. Like for me, I didn't really want to enjoy life anymore because I was so consumed with getting rid of the PCOS and having a baby. And like looking back, I think about all the beautiful moments that I could have made that I could have made if I would have just enjoyed life while on the journey. And I feel like that's the story of a lot of women, especially those who are struggling with infertility is that it starts to consume you, and you forget to take care of you as a person, because your entire life becomes, I just need to do this to have a baby, and that's not how it should be. And so like when I say doing things to be intentional about self-love, immediately I start thinking about like self-care, which is also good for PCOS, and it's also good if you're trying to have a baby. Things like going to the chiropractor, getting massages, like hands-on ways, things that you are doing that lowers your stress levels, but it's also like showing your body like, I am worthy of taking care of you, body, right here, right now, today. Like I'm not gonna wait until I'm pregnant to get the massages. I'm gonna get the massages today because I deserve that.
Ooh, absolutely. Look, I just rebooked my massage. Because absolutely what you said, like you know, I realized, especially after having eaten, like, and I think that's the one thing that I've really struggled with. You know, I'm really good about being disciplined about my eating and
Mhm,
exercising, and
mhm.
but I think managing stress levels is really tough for me now in this season. And I know it's so tough for so many of us. That's the thing that really is hard for me. And so, you know, I started to do more things to just, you know, that will help just contribute across the board to, you know, managing my stress and, you know, getting my cortisol levels down so that I
Yes.
feel more relaxed, so I feel more calm, just making it more of a regular practice doing those things. And I'm trying to get back into regular meditation daily, like even if it's just
Yes.
5 minutes, because I know my body and my mind needs it.
Yes.
So it resonates with me so much. You know, I want to hear more from you in terms of, you know, just a few ways that we can become more intentional about self-love. You know, if there's a mama thinking like, okay, well, what does this look like? How do I start to become more intentional about self-love with PCOS? You know, what would you say to her?
Absolutely. So one thing that I like to have my clients do first is like write down all of the things that they believe about their body to see like what is it that I am saying or what is it that I do believe about my body first. And then I tell them to find affirmations after they get rid of all the negative, because most of the time when people have PCOS, they got all these negatives. They believe in very few positives. And I'm like, okay, we need to flip this, right? So let's find you, start with some affirmations, even if it's only two or three that you can believe right now today about your body. I need you to fill your cup up with some positive affirmations. And then for some people, if they really struggle, I mean, that was me too. So don't feel like you are alone. Um, Therapy. A lot of people don't consider therapy as a self care activity, but it absolutely is. And I absolutely want you to go and have that support to unpack some of those things that you are believing about yourself, and just to have support, because a lot of people don't feel like they can be transparent with the people in their life about what they are going through. You absolutely deserve support when you are on a PCOS journey. So going to therapy, surrounding yourself with support. And a lot of times I find when people start going to therapy, they are able to find their voice and either share what they are going through, but also find their voice in setting boundaries, right? Especially for those people who are struggling with infertility, they kind of just like sacrifice their mental health over and over again when they're going to like baby showers or having conversations with people about them having a baby, or just letting people ask them when they're having a baby over and over again. And I'm like, what are we doing here? Like, we have to set this boundary because your heart matters, your feelings matter, like you matter too. So you have to take care of you. People don't think about boundaries as self-care, but it absolutely is, again. And so going to therapy or just realizing that I need to do better in this area can really help with PCOS. And I mean, people, you can have one baby and then PCOS comes up and then you struggle again. So this just doesn't apply to people who have infertility the first go around. But even if you're having secondary infertility, you could tell people to stop asking you when you're having a baby, another baby.
Ooh, so many things you said that just really I want to emphasize. Like you said, boundaries is self-care. Absolutely. Like, you know, those of you all who are like solid balanced working mama from day one, people, y'all know, you know, part of our balanced framework is bold and firm boundaries. Like that's the very first thing that we talk about, you know, boundaries being a part of your wellness. There is no balance in motherhood if there's no boundaries. And so you absolutely need to know like where do those boundaries need to be, you know, with family, with friends, with even with your kids. And so for this situation, what I heard you saying is, you know, it's okay to let people know where the boundaries are with regard to your health, your mental health, your needs. Like that is absolutely self-care and wellness. Um, the other thing that kind of really resonated to me and something that I'm wanting to work on is, you know, that affirmations piece. And, you know, I think, as soon as you said like thinking about the things that you're saying or believing about your body, I realized like there's so many negative things that I've, you know, taken in about my body. And one big thing that I'm really working on is this feeling of not being safe in my body, you know,
Mm,
because it, you know, sometimes when we have things go on, whether it's PCOS or I know I had some postpartum preeclampsia, just these things that feel scary.
Right.
It can make you feel not safe in your body. And that has been the thing for me. So when you said flip it, the thing that came down, and I'm gonna write it on a post-it and put it on my mirror, is that I am safe in my body. And I think that will help me to just like feel more loving to my body because there's not so much fear. So highly encourage anybody who just heard Raye say this, like think about the negative things you're believing or saying about your body, flip it and let that be your affirmation. And
Yes.
really, shower yourself with that, because I know that that's going to be something that I'm going to be working on too.
Absolutely. And I love that you said you're going to put it on a post-it note because I have post-it notes everywhere. I always have, like, with those affirmations, because you really need to see them over and over and over again to keep it in the forefront of your brain.
Ooh, girl, I need to get on my affirmations. I need. I'm gonna work on it. So that was good. Wow. Is there anything else that you would like to share with us about PCOS, about self-love, anything that comes to mind that you feel our mamas need to know?
Absolutely. I feel like I could talk about PCOS all like for hours and hours and hours. But I think the main thing I want people to know is that your body is not broken. Your body has not failed you, and you don't have to navigate it alone. So you can find there are so many support groups out there for people with PCOS, or even if they're just connecting with one other person that has PCOS. So like you are not the only person in the world going through this. There is somebody that can absolutely relate to you. And on the same token, find those supportive providers. So a therapist, a OBGYN, or a midwife that can support you as well.
Yes. Oh my gosh. Thank you so much, Raye. Like,
You're welcome.
it is always a pleasure talking to you. Like, I love talking to you. There's like this calm that I feel now because of it. But also, I just know that the mamas are going to really value so much from this conversation. So thank you. And how can the mamas connect with you if they would like to after this?
Absolutely. And I want to say thank you again for having me. I feel that same type of calming spirit. I think it's just there among you and everything that you do. But y'all can find me at Everyday with Raye on Instagram. That's just like my personal journey documenting my own self-love journey throughout life and all of these different stages that I'm going through. And then I'm also Raye the Doula if you're interested in everything related to PCOS. And I do have some exciting things that I'm working on specifically for people with PCOS. So stay tuned there.
Yes. Oh my gosh. Thank you so much. I'm so excited for the mamas to connect with you and to hear this episode. I know that it's going to be really valuable for them.
Thank you so much.
Hey, Mama. Thank you for listening to the Balanced Working Mama podcast. If you love this podcast, please be sure to rate it and share it with another mama that you know. And don't forget to follow me and Balanced Working Mama on Instagram. I'll talk to you soon.